Here's a video of transferring some mycelium from a Petri dish onto some other Petri dishes. I like to use a sterile needle to cut out and manipulate the agar because it's already ready to go. First thing, sterilize your hands or sanitize them. Technically, isopropyl doesn't sterilize. I haven't yet to find the chemical that is a good sterilizer, but also friendly on the skin. Hydrogen peroxide will bleach my skin completely white, and it gets painful. So I'm transferring this one just because I think it looks kind of sketchy. It's from a spore syringe, and there's different little growths on it. So, I don't see a whole lot of rhizomorphic growth, and it looks weird, so before I use it for anything, I want to just get some of it partially isolated at least, and to see that it is truly good and not contaminated. These come sterilized, so they're ready to go. You don't have to use flame, and I like to have them, when using a flow hood, instead of a still air box, I like to have them on a little platform just because I'm worried about the lower layer kind of kicking up contaminants on the ground from the table. And this way I feel like it gives it a better chance, or like less of a risk of contamination. It's important to keep the Petri dish lid so you can put it back on later. What I'm doing here, sitting it on top of the Petri dishes I'm about to use, is not the best move. But you just cut out a little square, and then you can pick it up with the sterile needle. Try to keep your hand from being in front of the flow hood. And there you go. Pretty easy, pretty effective. I'm going to do a few of them just to see if there's any better growth than others. Sometimes the agar is more difficult to manipulate than you'd like it to be because it's sticky. Perfect example. But yeah, pretty simple solution. Don't need anything fancy, just a pre-sterilized needle, and you throw this away after.